with us this evening. And welcome from Wolfville and Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq Nation. And welcome to another Acadia alumni virtual event presentation. Summer is near and the weather is certainly improving, reflective, I think, in our numbers here this evening. However, as the panelists know, and now anyone in the audience will know, that we are recording this event, and we're then able to add the plethora of knowledge that will be shared with us this evening to our broader community in alumni and even beyond, as we posted in our virtual events library. So hopefully that's good with everybody who's on the line here this evening. My name is Una Proudfoot, and I'm the Executive Director of Alumni Affairs in the Office of Advancement at Acadia. And joining me this evening are three very recent grads who have found their way into the world of physiotherapy in one way or another. And as this is Physiotherapy Month, we thought we'd invite you along to share your experiences and your perspectives with us. And hopefully some pointers on how to get the kinks of winter out, along with the residue of COVID. So no pressure on the three of you this evening. So I'm just going to take a moment to introduce each of our speakers. And then what we're going to do from there is ask each speaker to share with us, as I say, a little bit about sort of what specifically they're doing outside of what I introduced in their biography. And perspectives on particular angles of physiotherapy and things that are relevant in this day and age, work that they're working on, research that they're doing, pointers, as I say. Hopefully, I know that that's certainly what I'm hoping for on how to get started in this beautiful season that is upon us. So in alphabetical order is how I chose to do the introductions this evening. We have Captain Jillian Burton, graduated from Acadia University in 2016, earning a Bachelor of Kinesiology. She enrolled in the Canadian Armed Forces following her graduation from Acadia and completed her Master of Science in Physical Therapy at Queen's University in 2018. After the completion of her physiotherapy studies, she was posted to Canadian Forces Base CFD Halifax, where she completed her military physiotherapy training and acted as the second in command of physiotherapy until being posted to CFD Kingston in 2021. She is currently the second in command of physiotherapy at 33 Canadian Forces Health Services Centre, Kingston. Jillian is passionate about incorporating functional fitness strategies into treatment programs at all stages of rehabilitation. She was involved with varsity strength and conditioning programs while at Acadia and has provided physiotherapy coverage for the Canadian military men's volleyball team. In the summer of 2022, she will be working alongside medical technicians on the Army Patrol Pathfinder course, providing physiotherapy care for course candidates in a field environment. In her spare time, she enjoys sports, cooking for family and friends, and spending time with her husband outdoors. Welcome, Jillian.
Thank you.
Next up is Tyler Dillman, class of 2014. As a physiotherapist and owner of One-to-One Wellness, Tyler's commitment as a healthcare professional is to create a safe environment for individuals to learn how to integrate healthy lifestyle practices that enhance quality of life and increase participation in meaningful activities. Tyler is a graduate of Dalhousie University's Masters in Science PT program. He has a Bachelor of Science in Psychology from Mount Allison University and a Bachelor of Kinesiology from Acadia. With interests in pain science, behavior change, therapeutic relationship, and chronic pain, Tyler's whole person philosophy to patient care is based on the understanding that an individual's health is influenced by the complex interactions among many biopsychosocial factors. Through listening and validating patient experiences, Tyler aims to create successful, unique, and meaningful treatment plans to help optimize an individual's health. When not at work, Tyler can be found spending time with his wife and two sons, exploring hiking trails and discussing fantasy sports with his friends. Thank you, Tyler, for joining us.
Thanks for having me. Appreciate it.
And finally, last but most certainly not least, we have Carson Halliwell, class of 2018. Carson graduated from Acadia University in 2018 with his Bachelor of Kinesiology and continued on to a Master's in Rehabilitation Research at Dalhousie University. Carson is currently in the second year of his PhD in Health at Dalhousie, where he focuses on human movement science and three-dimensional gait analysis in individuals with lower limb pathology. Carson's main research objective is to help individuals with pathology maintain their overall health and physical function through physical activity. He has presented on the importance of physical activity for improving and maintaining physical function at several national and international conferences. His current research project looks to evaluate how physical activity guidelines affect the unaffected knee in individuals with knee osteoarthritis. hoping to inform biomechanically driven physical activity recommendations. Thank you, Carson. And the other two had a line or two on what they do in their spare time. And just before anyone joined us, we were hearing that in Carson's spare time, he is busy training and doing all kinds of adaptive life skills for a 5-month-old golden retriever. So Carson, thank you for joining us as well.
Yeah, thanks for having me.
The common denominator, you're welcome. The common denominator, of course, that we have here this evening, and I might as well call it out right at the beginning, is recommendations from Ann Dodge for each of you to join us. So thank you for answering the call. I'm incredibly delighted to have your expertise and your experience with us this evening. I'm doubly excited to have recent graduates who are doing amazing work in a few short years from your graduation. So again, thank you for being here. And enough from me. I will sort of interject throughout the conversation when there are questions either from the audience or frankly, if I have some questions myself. We'll wait until obviously after each of your presentations, but also encourage dialogue between the three of you. So coming from it from different perspectives and likely having questions or perhaps even challenges for each other's perspectives might be really interesting. And the final thing I'll say before handing it over is to say that in reading your biographies and hearing about overall perspectives in terms of wellness and not just the physical piece of it, I think has become incredibly important in society in general, but in particular in the last couple of years. So certainly really interested to hear that sort of full perspective on each of the areas of wellness and how they all interconnect. So enough from me. I believe that you drew straws to see who's going to go first. I'm just kidding. I'm sure there's a very logical reason. And Carson, we're going to toss it over to you to kick us off here. Yeah, I'll keep an eye out for questions in the chat function. And over to you.
Awesome. Thank you very much for the introduction. And thank you for having me. I look forward to this discussion quite a bit. I'd like to keep this relatively informal. So if I do say something that piques your interest, feel free to throw up the raise hand function or just interrupt me, as I've gotten used to during these virtual events. But as Una said, so I graduated in 2018 from Acadia's kinesiology program. I then went on to a master's in rehabilitation research through the School of Physiotherapy. So I'm not a clinical physiotherapist. I do research through the school to try to inform healthcare practices. In 2020, I finished my master's and started my PhD in health, currently in my second year. And as was stated, my research focuses on clinical biomechanics, which in short, I look at three-dimensional motion analysis of walking. And what I try to do is identify ways that people may be walking that may be localized to a specific health condition. So in my case, I look at osteoarthritis specifically. And essentially, we want to try to look at how these potential walking patterns influence disease progression. And in this, we also want to look at how prolonged physical activity may be impacting these walking patterns and influence disease progression. And then as a side note, we also tend to really try to hammer home the importance of physical activity for maintaining physical function, both in people with and without knee osteoarthritis, maintaining functional independence and overall health and quality of life. So as we get started, I think a common misconception is that when we think of health and maintaining health, we tend to focus, only on physical health, as Una said, when in fact this really only paints half the picture. So the World Health Organization's definition of health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. I also think it's important to note just how many variables can influence someone's health, including all the social determinants of health. However, physical activity is a major piece of the puzzle. So as I get started, I wanted to bring up two separate concepts that often go hand in hand with one another, which are physical activity and sedentary behaviors. So physical activity is defined as bodily movement produced by skeletal muscles that increases energy expenditure, or in short, any voluntary movement that just gets you moving. So this can be walking, swimming, cycling, weightlifting, running, etc. Anything that gets the heart rate going and the breathing elevated. And regular physical activity reduces the risk of a number of chronic conditions such as cardiovascular disease, diabetes, some form of cancers, risk of falls. It's also associated with decreased depressive symptoms and anxiety, as well as reduced all-cause mortality. But it's important to note that it's an inverse relationship, meaning as one goes up, the others tend to go down. So as physical activity increases, our risk of these comorbidities tend to decrease. As our comorbidities increase, our physical activity tends to decrease. So it's almost like a seesaw effect, and it's important to maintain our physical activity for long durations and not just have these spurts of physical activity for a little while and then kind of teeter off and then try to jump back into it. And on the flip side of physical activity is sedentary behavior, which are situations with low energy expenditure, such as sitting, reclining, or a lying position. And recent evidence supports that physical activity and sedentary behavior influence health independently of one another. So it used to be thought that if you go and reach your physical activity goals for the day, then it really doesn't matter what you do for the rest of your waking hours because you hit that threshold. When in fact, the benefits of reaching physical activity guidelines can be negatively impacted by prolonged sedentary behavior. And interestingly, long uninterrupted bouts of sedentary behavior is actually found to be worse than total sedentary time. So if you have more total time in your day being sedentary, but you break that time up into small bouts of physical activity, 5 or 10 minutes here and there, it's actually more beneficial than if you have less sedentary behavior, but it's longer duration. And increasing sedentary behavior is associated with increased risk of chronic conditions such as cardiovascular disease, diabetes, some cancer, risk of fall, depressive symptoms and anxiety, and all-cause mortality. So current physical activity recommendations call for 150 minutes of moderate to vigorous physical activity per week in at least 10-minute bouts. However, it's important to note the importance of small bouts of physical activity that may not reach that 10-minute threshold, specifically if that's all that can be done. Someone may have a few chronic conditions or just functionally unable to maintain physical activity for that long. So really just getting up and moving in any capacity, especially for older adults or at-risk populations, is especially important. And I just wanted to touch on how the COVID-19 pandemic has had a lasting impact on the physical activity levels of individuals. So a recent systematic review, which looked at 45 studies encompassing over 86,000 individuals, only one paper didn't report decreased physical activity levels from the beginning to the end of the pandemic. And another 26 studies examining changes in sedentary behavior, every single one showed increased sedentary time. So we have this situation where we're decreasing our physical activity and increasing our sedentary behavior due to lockdowns. And I think we're beginning to see the impact that the pandemic has had on the health of Canadians and the stress that this is really going to have on our healthcare system. So closure to non-emergency surgeries has led to an unsustainable wait time for medical procedures. So this is just what I'm most familiar in, but it's really any surgical procedure. But joint replacements completed within the Canadian 6-month benchmark fell from 72% to 51% nationally. And here in Nova Scotia went from 53% to 38%. So we're really seeing this bottleneck effect of this reduced physical activity, increased sedentary behavior, non-emergency surgeries are locked down. People need these surgeries, they can't get them. And as people wait for these medical procedures, generally it's found that physical activity is decreased in fear of aggravating symptoms and making conditions worse. So as we kind of see these mandates come to an end, I think the question that we need to be asking ourselves is, how can we begin to increase our physical activity and decrease our sedentary behavior at least to a pre-pandemic level? And I look forward to discussing that topic with you all here today.
Thank you so much, Carson. So many notes that I wrote down, so many questions I have, so many comments. When you spoke about the behavior of sort of doing it and then activity and then not, and then flipping back into it, I was like, oh, he knows me. Because that's you've pretty much just described, my behavior as it looks right now, which is frustrating and disappointing. And lots of great points about, cumulative versus that chunk of time. So a lot of people think, well, I can't possibly wrap my mind around doing an hour of physical activity a day because I've got the kids, I've got my job, I've got, X, Y, and Z. So understanding that cumulative piece of 10 minutes here and 10 minutes there and 10 minutes here is just as beneficial, if not more beneficial. So really appreciate that. And as you were chatting, I thought of one of my favorite videos, and it's called 23 and a half hours. I don't know if anyone is familiar with it, but if you're not, I'd love to hear your input on it. And the concept behind it basically is if you can resign yourself to not moving for 23 and a half hours of your day, you're fine. Meaning, if you can move for 30 minutes every day, you're going to see increased benefits. So it was a really kind of neat twist on wrapping your mind around exactly how much that you need, how much time you need. So thank you very much for that introduction and for some of those comments and thoughts for us to think about, staggering statistics as well. And it's interesting. I don't think anyone is surprised to hear decrease in physical activity, decrease in access to some of these procedures that need to happen through COVID. It's recognizing it, and I think we're all doing a much better job of recognizing it, and then understanding what our next steps are. I have a friend who's a medical doctor, and he refers to, I was going to say the fourth wave, it's like the fifth or sixth wave now, but that wave being that fallout of all of these variables that are now affecting us, having not been active for 2 years, and what those issues look like outside of COVID itself. Enough for me. So Jill, Captain Burton, over to you next to share some insights and some comments with us, please.
Thanks, Una. I know that Carson mentioned that there are many dimensions to how we're healthy or what does health look like, but I'm going to focus really on strength in our everyday lives. So we'll kick it off here. As Una mentioned, I started my career in Halifax and I was working with primarily a naval population, and here in Kingston, I'm working predominantly with an Army population. Members of the Navy have to live on a ship for months at a time in very small spaces on an environment and a platform that is constantly moving. And then people in the Army are expected to carry more than 75 pounds on their back for long days in very hot and very cold conditions. What holds true with this is that no one has ever been worse off for being stronger, but this is true for everyone, not just in the military. It's true outside the military as well. So the demands of the population, as I mentioned, are quite different, but there is one phrase that I've modified slightly for the presentation here today. It's a phrase by Mark Ripto, and it's that stronger people are more resilient than weaker people, both mentally and physically. So to step away from the military environment, I really want to talk about this in terms of our lifespan. For example, you have a high school soccer athlete who injures their knee and they require knee surgery. The stronger that person is going into surgery makes their recovery much easier. So for some, this might be quite intuitive, but we can actually extrapolate this to our entire lifespan. Another example would be our 75-year-old person who's waiting to have a hip replacement. And this person, for them, being able to pick up groceries and carry them into the house, or pick up a laundry basket off the floor and carry it into another room, would be considered a very important activity. For this person, if they can only lift the laundry basket once off the floor before they need to take a break, then we could really essentially classify this activity as their 1 repetition max. So for anyone on the call who is unaware of what a 1 repetition maximum is, it is the maximum amount of weight that a person can possibly lift at any one time. So if we imagine this person exercising every single day and having a professional guide them towards their goals, it's not unrealistic for us to think that they could pick up a laundry basket more than 20 times in a row. And I'm just making that number up. The potential is probably endless, but they could definitely do it 20 times in a row. So this really brings me to my next point, which is, what does getting strong look like? And for us, society and the workforce has evolved for many of us to spend most of our day sitting. Carson touched on this as well. We rarely, if ever, have to lift something that is difficult for us. They're difficult enough for us to consider it heavy or very difficult. We cannot change the science behind strength training. In order to build strength, we really have to constantly challenge ourselves physically in order to maintain the strength that we have and become stronger. So again, we'll come back to the office setting. For many of us, that means making a conscious effort to become stronger, to deliberately choose to exercise. So I will come full circle back into the physiotherapy profession. And this is something I've seen since I graduated Acadia, not even 10 years ago. We've seen exercises that have been classified as dangerous or unsafe or pointless. And just to name a few, I've written a few down. Shoulder shrugs, lifting things upwards. A long time ago, that might have been something you think only bodybuilders do. And then people said, oh, that's dangerous, don't do it, there's no point. And now we're seeing research that comes out that actually suggests that the muscle that attaches your shoulder to your head could actually resolve some of your neck pain. I've heard it discussed in terms of a deadlift. And the deadlift is a scary movement for some, but it really does play a really important functional role in the things that we do every single day, just like a squat does. The ability for you to stand up in and out of a chair over and over again, it's a squat. So we need to not be afraid of these exercises. And I really hope as a profession and as society, we kind of move away from saying that exercises are dangerous or they're unsafe. And we just move towards encouraging people to find new activities that they're interested in, to access healthcare professionals, not just physiotherapists, and really find someone we trust to help us achieve our goals.
Thank you so much, Jillian. Again, so much to think about and so much to sort of organize in terms of thoughts. And for folks who are on the line and folks who will view this video later, if they're anything like me, I'm sitting here and I'm thinking lots to remember, lots of choices to make. When you talked about finding activities that you enjoy, I mean, I think that's an important piece of it. I mean, I think there's some activities that we need to do, to your point about shoulder shrugs and deadlifts and squats, that we don't necessarily enjoy. But so much of our movement can be around things that we do enjoy doing. And one that comes to mind that I'm starting to get more and more into is gardening. But again, to your point, being able to get down to garden and get back up again, or to be able to move that bag of sod or soil or whatever it is that you're doing, and being able to, sort of keep up with that and improve your circumstances as you move through your ages and stages in life. So lots of questions on your information as well. I'm gonna go over to Tyler and hear from him for a little bit, and then perhaps generate some discussion amongst you in terms of some questions and some pointers. So thank you for that, Jillian, and over to you, Tyler.
Okay. Well, first, thank you to the Acadia Alumni Association for inviting me to speak here today. Thanks to Jill and Carson as well. A lot of great information there. So thank you, and hopefully I can build off that. I graduated from physio school at Dow in 2016. Took over one-to-one wellness in 2020. My main area of focus and patient population tends to be with chronic pain, complex chronic conditions. And so the strategies that I've taken have been to try and encourage people and motivate people to adopt healthy behaviors. The NICE guidelines out of the UK say for chronic primary or secondary pain, they should be including physical activity and strength training and exercise into the rehab program to reduce the comorbidities that come along with it due to the sedentary behavior that we see. And it's very it's interesting with chronic pain and complex pain and these conditions, because you experience pain with movement, and that's not very motivating. You really have to trust the provider that you're with and your healthcare team to say that is okay. That's actually safe to do, because your body is telling you one thing: it's not safe. I'm in pain. That hurts when I go to bend over. That hurts when I do a leg press or a squat. And so hopefully today, my goal and kind of my objective is just to provide a few tips for how to motivate in a healthcare setting, maybe a few questions to ask for patients, general population, even just some things to consider when you're looking to adopt new healthy behaviors. We know that it is, there's more people out there doing unhealthy behaviors than there are healthy behaviors. And so you're going to be outside the norm when you're looking to adopt healthy behaviors, whether in pain or not. So who's going to take you through that uphill battle, and who's going to support you through that? So in my opinion, one of the best things that you can do as a care provider is very early on build a very trusting rapport with somebody. Listen to them in what they're saying. Engage. It's been shown that healthcare providers interrupt their patients within like 11 seconds. Hard to get your story out and tell somebody what's happening in 11 seconds. And why that happens, I'm not quite sure, but I think it needs to be addressed. Patients need to be heard, right? As a provider, it's really important to reflect back of what you heard, so they know that you've listened, you're empathizing, that they care. Right? You're just not another patient coming across their table, that you are an individual to them beyond the pain that you're experiencing, what brought you to that room today. And through that, often validation for the experience really comes in. So with that, what questions can you ask, and what questions can you consider as a practitioner and patient? One of the main things: what are your overall goals? What are your overall goals? What would you like to do? How do we increase your participation in meaningful and enjoyed activities? Where's the starting point for that? In the very first session and every treatment session, what would you like to get out of today's session? What can you leave here with? How do you empower that person to start thinking of their own health and what they want, not what we're saying they should do, right? And that's such an important point. It is about that the patient and what they need and what they want, and how do we get them to start to follow some of this research. We know that they can be better, they can be healthier if we get through this hurdle of starting these behaviors. One of the things that trying to achieve in the physiotherapy world in general, working with some practitioners, some professors at Dalhousie, is trying to understand some of the psychological processes that happen within the physiotherapy profession without people even knowing it, without even practitioners even knowing it. How the words you use during a healthcare encounter matter. Telling people, oftentimes what you hear is people are left feeling maybe like they're weak, like they're in pain, they can't move, they're restricted, but they don't hear any much positive during a healthcare encounter. Oh wow, you have way more range of motion in that way than I thought. Those little subtle different sentences can make a big difference in how people come out of your treatment room. So what are your fears, right? What are your fears if your health does not change, right? Where are things going to be, and what's worked for you before? What hasn't? Those questions can go quite a long way. And finding successful starting points, as Carson had mentioned there. It's about finding successful starting points. It's where are you going to start to make sure that we can just keep layering on and adding these healthy behaviors. How do we increase your time? If you're in pain for 24 hours a day, and every time you move you're in pain, how do we get you to move and start to trust your body again, right? Is it 5 steps? Is it 10 steps? Oftentimes you see this boom or bust model in chronic pain, where people go and try and do 5,000 steps and they were only doing 500 before, and they just leads to exacerbation of symptoms. So, and then going to the element of safety, and with the shrugs and the deadlifts, and one of the main questions that I like to ask, and it can help people just get out of the take their attention away from their pain, is, does this feel safe? Does it feel safe? And oftentimes people need support to feel a little bit more safe and to adhere to these exercise programs to be able to adopt healthy behaviors that we just need everyone to. We're healthier as individuals, we're healthier as a society, as a collective group, when people are active and engaged in physical activity. And there's many ways you could look at, do we need to start with education? Is that the starting point? Do people just need to learn more about what they're experiencing and all the factors that come into play? Is it some sort of different movement? Is it learning to meditate or relax? Is it maybe yoga or somatic exercises? Where do we start with the strengthening, right? We use a slow motion protocol at our facility, and it really helps people experiencing significant pain just feel safe, right? They're moving slow. I'm right there telling them that it's okay, asking them if it feels safe. And that just helps people overcome a little bit of a hurdle. And what other healthcare providers need to be in the mix here? Do they need to be working on their nutrition? Do they need to be working on their sleep? Where is that starting point? And that is kind of the art of the professions and healthcare professions, is working with people to help them find that point that gets them moving towards increasing their participation in meaningful activities. It's really fun. I think that's it. I don't know if that was more of a tangent or including some information on with that, but yeah, there's a lot to be said about people being healthy, choosing healthy behaviors, and how you incorporate the research that we're all doing, and making it being able to translate that into everyday language.
Mm-hmm. Thank you for that, Tyler. And while you were sharing your information and giving your examples, a lot of times my mind went to a place where my mother was going through rehabilitation. She was diagnosed with cancer at the base of her spine, which affected her walking. And I was there when the doctors delivered the news that she'd never walk again. And of course, when she said that to me, I was mortified. I was like, oh no. And she looked at me and she said, imagine telling someone they'll never walk again. And she was up within 6 months. So, and I just think I hear what you're saying about safety and feeling secure and feeling safe and having that relationship with your healthcare providers. And I can certainly say that Mom's experience was exactly that, and having a lot of people helping her along the way. And certainly many of whom listened long after 11 seconds. That's a staggering number for me to hear from you. So really impressive to know that even research and understanding that number exists is great, because it certainly is a suggestion of a place of where to start. So I have all kinds of questions, but before I sort of start to kind of say, okay, this one's for you, Tyler, or this one's for you, Jillian, or this one's for all of you to take a stab at, what I'd love to do is pause for a moment and just ask each of you, after you've heard each other's sort of beginning piece and sort of the angles that you're coming from. If either of you have questions for one another or would like to comment or address a comment that anyone else has shared so far. This is where I try to create some dialogue amongst the professionals on our call.
I had maybe a clarifying question for Carson. What you mentioned about prolonged physical activity. Are you able to just explain that point a little more? Is that more of saying if you're exercising for too long that it has the detrimental effect? Because most people think more is better, right?
Yep. So it was actually prolonged, uninterrupted bouts of sedentary behavior is worse than total sedentary behavior time. So if, say, during the day, someone's sedentary for 8 hours, but it's constantly being uninterrupted by short minutes. So maybe every 45 minutes you have an alarm on your phone, it goes off, you get up, you walk around the office, you come back, you sit down, versus someone who maybe is only sedentary for 6 hours a day, but those 6 hours are constant. They sit down, they get home from work, they binge, whatever the hot show is on Netflix for 6 hours straight. even though their total sedentary time is less, it's worse for that outcome. But to the point of physical activity, there's obviously, like you said, there's a point of too much, and I think it varies on person, and I think that's important to know person to person. So Una, I can sympathize with your mother's situation. In the fall, my mom, they found a brain tumor, so she went in for surgery. The doctor said, similar thing, you probably won't walk again. And within a month, mom's calling me saying, I just walked to the end of the driveway and back. And it was like she just ran a marathon. It was, so for her, just doing that is just as strenuous as me going out and doing a 5K. So it's very person specific. And, like you said, Tyler, asking someone who does 500 steps a day to, okay, go to get your 10,000 steps in on your Fitbit. It's not a realistic goal to start out like that. I hope that clarifies your question.
Yeah, thank you.
I have a question for Tyler. And you were mentioning you're always checking back in with your patients and you're saying, does this feel unsafe, or how do you feel about this? How often in a clinical environment are you pretty aware that maybe their abilities exceed what they know they're capable of, and you are looking to push them a little bit further in that clinical environment just to make them believe in themselves?
Well, I think that's often what we do as physios, is make people believe in themselves a little bit more. So quite frequently in the treatment plans that I come up with, I start low. Because I want them to feel successful and safe, and then I keep building time after time. And also, what I'm trying to evaluate in that time too is if it's a chronic pain, how their body's going to respond, and how they're going to respond from like a flare-up perspective. So trying to monitor, I typically use about the Achilles tendinopathy recommendations for where you can experience pain for about 24 to 48 hours after, because I think it's the most solid research we have on pain and productive pain, so to say. I think now there's a research study out there with hamstring tendinopathy experiencing pain as well, and determining if that was the appropriate amount for them, or can we move forward and finding that line. But trying to get people to believe in themselves and that they can push themselves a little bit further is exactly what we do. I think that if we take into account a lot of the anxiety and the fear that people have, that barrier of just saying getting into doing an exercise, you've already overcome a massive hurdle in changing their belief system within themselves.
Thank you for that, Tyler, and for the question, Jill, and for your comments as well, Carson. And when you were talking about, all of you referencing sedentary lifestyle at various points, and when we sort of think about the last 2 years in COVID and that amount of time of sitting, for long periods or shorter periods, but completely sedentary. And I think that that's where, regardless of one's vocation or one's job or whatever it is that they're doing, that many of us in society have experienced 2 years of very little movement. In an office environment, for example, when we have meetings before COVID, we would walk from one meeting to the next meeting. So you were moving in between meetings, but now you're going from virtual meeting to virtual meeting. We're starting to come out of that, but it's interesting to me how many virtual meetings I'm still having, because now we can, and it's so much more convenient and takes up less time. And so it's sort of that evil that became very good, but is kind of sneaking back into that evil again, because it's easy to say, I won't walk up the hill. You all know the campus, right? And I'm at the bottom of the hill. I'm like, why am I going to walk up the hill to a meeting when I can just zoom you up on my screen here and have that conversation? So lots of hurdles, I guess, is what I'm getting at to get over, regardless of what your status was heading into the pandemic, right? So hearing about different ages and stages in life and other variables that have factored into people's physical activity. So if I were to ask you, all three of you, this is a question to all three of you, to say to you, what is your recommendation, or what's that one piece of advice, or maybe it's your 20 to 30 second soapbox opportunity to share with us your advice on how to become physically active again. Talk to those of us who really have let it go in the last couple of years, and maybe even just over the winter. Maybe I shouldn't blame COVID altogether. What does that look like? How do you return to physical activity? Any advice, or your top piece of advice, maybe?
I can lead it off.
Sure.
So I think one of the main things, especially with any physical activity or some of the stuff, we don't seek challenges. We like comfort. Like, if we can do a meeting virtually, why would we go run to another meeting? If we can do it virtually, why would we drive there, especially with the price of gas? But I think one of the most important things we can find is finding a support network and a support group. So maybe that's a child, a parent, a friend. My partner and I, sometimes I don't want to go for a walk. I don't want to go for a run. That day she does. She doesn't want to go on the next day. That day I do. And we kind of push each other back and forth to get each other out and hold each other accountable. So I think the feeling of not wanting to get into it is common, and it's when you are motivated to take advantage of it, and when you're not motivated, having someone there to give you that kick in the butt, I think is important.
That's great advice, Carson. And I did not ask you what your dog's name is, but I'm guessing that your dog is part of that support network as well.
Yes, he certainly makes me know if I'm not giving him enough exercise. But selfishly, sometimes I do it to tire him out for my own peace and quiet.
That sounds like a win-win situation to me. So I think that's pretty good.
Yeah.
Jill or Tyler, your piece of advice.
Yeah, I'll go next. My biggest piece of advice is actually something that Tyler already mentioned, and that is build habits. So he mentioned it in a context of starting with something that you know that you can accomplish to build the confidence for later. Sometimes I've seen my patients do this by themselves, and I've even done it before. You're lacking motivation, it's COVID. Find something and say you're going to do it every single day, whether that is just air squats. And you say every day you're going to do 50 of them, or you want to get better at push-ups, then do X number of push-ups every single day that's within what's actually realistic for yourself. And make sure you do that one thing every day, even if it only takes you 5 minutes. I think that we intuitively are creatures of habit, and building habits and routine around everything that we do makes everything a lot easier. So once you build one habit, I think a few more of them will fall into place. The other thing that I would recommend, and I know it's very difficult, especially with money being tight these days, is that if you have the means, is to reach out to an exercise professional. There's lots of different ways you can do that, whether it's one-on-one or a YMCA. Maybe there's a local community center program or a group fitness class. But go and reach out to other people. And I think the group aspect of exercise, like I said, at a community center or at a group gym, that social aspect is something that we missed out on so much during COVID. And I don't know that we fully appreciate how much we need it. And getting yourself into a social network surrounded by people that want to build those habits with you will definitely lead you to success.
Terrific. Thank you. And that triggers another question, but I'm going to come back around after we hear from Tyler.
Well, I think Carson and Jill kind of hit it, like nailed it right on the head there with both of those. Picking one thing, starting with that, feeling successful with that, no matter how small or how big, just get started. Like Jill said, if it's just one squat a day, even if it's one apple a day, or flossing your teeth at night, just pick one healthy behavior that you feel confident that you can stick with every day, and take it day by day. Don't judge yourself if you have a setback, if you don't do it for a couple days, right? It's that's okay. And that's just human nature. It's hard. It's really hard to do this stuff. As I mentioned before, you're not within the norm of our population when you start to adopt these behaviors, and that's challenging. So just to Jill's point about community, I think it's called in Halifax Way for Wellness through NSHA. It's a community. They have a bunch of community programs, and it's all free, and that's a really good resource here in Halifax. I'm not sure exactly some of the programming that are in the rural community. Dr. Melanie Keats out of Dalhousie is doing wonderful things for cancer patients and exercise. The Access program there, another free program for people to be supported in a group while they're going through cancer treatments and post-cancer to strengthen their body. Wonderful research from that group, in my opinion. And reach out for help if you don't know where to start, even if it's just a phone call, even if it's an email. To some providers of just asking, hey, is there anything in the community that can help me with whether it's my chronic pain or getting moving. Finding that support is important.
Tyler, can you just repeat again you referenced some letters, and I think you also gave a name of a program. Could you just say it again, because I didn't quite catch it?
I think the community program is Way for Wellness. I think. Okay. I'd have to confirm that. And then the Access program, ACCESS. I don't know exactly what that stands for, but it's for cancer care and exercise. And I actually think there's another kindergarten that's starting to get in on that program as well. But those would be the two. Yeah.
But the Way for Wellness, was that Nova Scotia? I think you said NS something.
Oh, the Nova Scotia Health Authority? I think it's run through the Nova Scotia Health Authority. Yeah, I think.
Okay, perfect. Yep. Awesome. So my question is, and I'll give you a moment to think about this one. So you've referenced, both of you, or two of you have talked about building habits, and you've all talked about support networks. So on the building habits piece, if you could pick one habit that you would suggest that those of us who are doing pretty near nothing right now, what's that one that you would say you're going to get your best bang for your buck, or it's that sort of really pinnacle starting point to launch off everything else? And it could be, to your point, Tyler, flossing every day. Maybe that's what you're like, you know what, floss every day, because that's your first step. Maybe it is 10 squats before you get into bed. I don't know, but that's what I'm asking you. If you had to pick one, if I said to you, I'm such a mind mix up and I don't know where to start, give me that one thing I need to start tomorrow morning, what would it be?
Wow. There's so many. I would have to recommend kind of weighing some of the ease of I would say walking. If you could walk, that would be a big one. I think a bigger one and would be nutrition. I think that's huge. I think that's up and coming. The research is already there to support it, but how do we support people through that? It's next to like smoking, it's one of the most challenging things to incorporate healthily, we'll say, into our routine. So, but I'll say walking. That's what I'm going to go with.
And I'm buying you a little bit more time, Jill and Carson, because I just want to say, and the reason I'm kind of pinpointing you and making you answer this question, or at least asking you to answer this question, is because for many of us, when we hear all of the information that you're sharing with us, it's so overwhelming. It's overwhelming. So it's kind of like, okay, I'm hearing one habit at a time, pick a habit and start it. But I'm hearing so many suggestions. I'm sort of kind of helping folks who might be saying, where do I start? And Tyler, I appreciate that you mentioned smoking, because I mean, some of the ones are kind of really like high level main ones that if you can knock those off and sort of start making some positive progression that way, that's a great place to start. Nutrition is huge. right? So again, you know, you sort of think, okay, what's the one first step I can make? You know, is it less alcohol? Is it less sweets? Is it more vegetables? You know, those kinds of things. So I've heard you walking and nutrition. I've got lots of nutrition questions, but we'll pack that for another day. And then I'll ask Carson and Jillian if you have a different recommendation or if it's the same to add on to it as to why it's your recommendation.
Okay, I'm gonna add on to Tyler's. You know, he kind of hit the nail on the head. Nutrition is up and coming. There is a lot of link between what we eat and how we feel. And I really want to add on to his comment about walking. And I am not the best person to be preaching this. But if you are currently working and you have a lunch break, get up and leave your workspace and go for a walk during that lunch break. Sometimes I need my colleagues to drag me out of the clinic and go for a walk at lunch. And I really don't put myself first. I think every single one of us on this call can put themselves in my shoes in that case. So do what's good for you. Put yourself first. Go for a walk at lunch. If you are someone who works from home or you're someone who's retired, if you're sitting at, like, during your waking hours for more than an hour, find a way to get up every hour and move around.
Excellent, thank you. While you were describing that, Jill, where I went to in my head was a friend of mine who lived to 101 and a half. And when I asked him around the time when he was 99, I asked him, you know, how did you get here? And one of the things he said, go figure, was physical activity every day. And for him at that age, it was as simple as walking to the end of the driveway each day to get his mail, right? Because they had one of those mailboxes at the end of the driveway. And the other one was that he would jog on the spot while he waited for the kettle to boil, right? So just two simple things that he did every day. And at 99, those are huge. Those are big, big things, right? Carson, over to you.
Yeah, you're both stealing my ideas. I agree, walking, just from an ease and availability perspective for most individuals. Obviously, it's not feasible for everyone, but walking is good. Getting up at lunch, I love that. I go through phases of very, very high stress in graduate school, and I'll have my lunch while writing or reading or doing work. And, you know, I put more work in, but my work's twice as bad as if I just go step away, 45 minutes, go for a walk, you know, even just sit outside. Super important. But what I've found works for me, and what I've recommended to friends, is simply just write it down, what you want to accomplish in that day, whether it's, you know, walk to the end of the driveway, run 5K. I am an avid, before I go to bed, I jot what I want to get done the next day, whatever it is, and I strictly hold myself accountable to getting that done. I know it might not work for everybody, because there is sometimes it's like 8 o'clock at night and I'm like, I got to go do this, which isn't healthy all the time. But if you can just write down, you know, 1 or 2 things that you want to accomplish, whether it's flossing your teeth, doing 10 squats, I think writing it down helps keep you more accountable than just in your head saying, you know, I want to get this done.
Yeah, love it. Love that goal oriented and sort of taking it outside your body or outside your mind by writing it down. The mother in me wants to say the number one thing is make your bed every morning. Make your bed. It's the first goal that you accomplish every day. Make your bed.
I'm still working on that one.
I think there's a book about it. I think there's a book something to do that every day.
Yeah, pretty much. There's also a great video about a naval officer actually who talks about making your bed every morning. Another great video. And I just want to include, and I certainly am not the professional in the environment here, so certainly look to nod from each of you if I'm on the right track here. That when we talk about walking and we talk about getting up and moving, we're talking about very able-bodied language. So when you talk about walking, what I'm hearing is movement and elevating heart rate. So if you are not able to walk, pick an activity that does those same two things. Does that make sense? So sort of elevating your heart rate for 10 minutes, but also creating that movement.
Absolutely. I think you're correct in saying that. 100%.
Yep, exactly.
Yeah, and I have a patient right now that I'm seeing virtually, and they're a wheelchair user, and they box every day, right? They air punch and get their heart rate up that way. So yeah, move, get your heart rate up.
Okay, last question for you, because believe it or not, we're nearing the end of time. It's 7:56. We are seeing better weather. We start thinking about how do I, what do I do? I want to get outside. I want to get some fresh air. Nature is a great prescription. So lots of great information about that as well. Do you have recommendations outside of walking? So maybe more to your point, dealing about strength training, strength conditioning. Do you have a particular activity that you would recommend heading into the spring and summer months that might help with some strength and conditioning?
Yeah, I guess maybe more of a concept than any one thing. There's lots of things that you can find around your house that you can lift up. You can fill a bag with dirt and you can lift it. You can go to a gym. You can lift water bottles. And it really just depends on where your starting point is. This is a concept that I use with my patients almost every single day. And it doesn't matter if they are 20 years old or they're in their 50s or they have a fracture or they just had surgery and we're working through rehab. But it's a concept that I learned on a course. It's called reps in reserve. So in terms of strength and conditioning, if you are doing an exercise and at the end of that exercise, we'll use bicep curls for an example. Everyone knows what a bicep curl looks like. And you finish and you say, I could probably do another 10 of those. It's not hard enough. So until you're doing something and you say, I maybe can only do 2, 3, maybe 4 more of those, we're not really pushing the boundaries of what is strengthening.
Okay, that's good to know. Thank you. Right, you kind of I ease through some things, and I'm like, that's a breeze. Clearly, I'm still in great shape, but I'm bicep curling 3 pounds or something. So great advice. Thank you. And I think your point as well about you can find anything at home. There's a lot of people who are still anxious about COVID and anxious about the virus. So staying home is still a preference rather than going to a gym. So being able to understand that this physical activity and this strengthening that we should be spending more time on every day and thinking about can be done at home. Pretty cool to look around your house and come up with some ideas. In the winter, you automatically think about, shoveling your driveway, that being like the best cardiovascular workout ever, and also one of the most dangerous. I'm digressing. Any other suggestions on strength and conditioning options that we can think about heading into the warmer weather?
Tyler, Carson?
My suggestion would be picking up an activity like gardening. There's some lifting, making sure you're doing it safely, and taking frequent breaks to offload, especially in like if you're in a sustained position for a while, like that would be a time to offload. Make sure you're lifting those bags of heavy soil with not with your back, making sure you're lifting with good form. But I think there's just ways to have challenging activity that's fun and enjoyable as well. So, but Jill said it right. You do have to challenge your body significantly to get the true effects of strengthening, and that's where making sure you feel safe to challenge your body in that way first before you go and adopt it individually can go a long way for a lot of people.
Yeah, absolutely. Thank you. Carson, how about you?
I would say for me, we generally focus on, just function with ADLs. We're working with individuals with osteoarthritis or at-risk populations. So if you find an activity that is quite common in your daily life, maybe it's doing the stairs, don't take the elevator. Walk the stairs if you can. If there's, going to Tyler's point, if they're in a wheelchair and there's a wheelchair ramp, use that rather than taking the elevator up. maybe this is walking again, but if you take the bus, I take the bus. I always stop one bus stop before where I go. I hop off, I walk there, park at the back side of the parking lot when you go to Walmart. It's just little things that I think we overlook that cumulatively can make a big difference.
Yeah. What I'm hearing over and over again, and I mean this literally and figuratively, is one step at a time, right? So that's great advice. And I do want to wrap up, but I do have one more question actually for the practitioners. When does someone know that it's time to ask for help? Like, what are sort of a thing or two to think about when it's kind of like, okay, I now know I need to go and seek out a healthcare professional to help me? Kind of a broad one, maybe.
Yeah, I can answer that from my perspective, but I do think that Tyler and I are going to have two very different experiences. I have patients who come to me because they failed their fitness test. I have patients that come to see me because they were told to come and see me. I have patients that come to see me because they can no longer do one thing that is required of them physically at work, and they're worried about their career. So those are the three big reasons people come to see me.
Yeah, and very insightful. And I'm guessing you're right. It will be a different response from Tyler, but still very, very real and very, very concrete examples. Thank you, Tyler.
Yeah, so I think that if you're experiencing pain, if you start to be scared of that pain, right? If it's starting to take away from your life and the things that you enjoy doing, that's a perfect time to reach out for help. If it's new to you, if it doesn't feel normal, another great time to reach out for help if able. Yeah, I think the big thing is if it's starting to take away from your day-to-day things, if it's making your life harder, making work harder, making you not sleeping well at night, and it's of all of your attention to not pay attention to it, then it's time to reach out for help.
Terrific. Thank you. We're at the end of our time. I am wholeheartedly sincere when I say this. Each of you have given me motivation to start to really action some of those. Oh, I really need to get started on this, and I really need to start doing this. I need to practice what I'm preaching, and so on and so forth. So I appreciate each of your perspectives. Thank you. Thank you for the time that you shared with us this evening. It's a busy world out there, and it's a late evening hour for many, especially those of you with kids and dogs and other important things to take care of. So thank you for that, and thank you everyone on the line for joining us. Happy to see some folks here. As I said, it is recorded. The virtual event has been recorded, so we will make sure that it's added to the virtual library. Our next event, for those who are interested, is on June 27th. We kind of dial it back to one virtual event a month in the summer months because we're hoping that people are getting out there and getting active and doing some gardening and doing some walking. So it's June 27th, and we've got a panel discussion on sustainable tourism. So if that's something that sounds interesting to you, getting out into our parks and our pathways and our hiking trails during the summer months, please join us on June 27th. So Carson, Tyler, Captain Burton, thank you very much for being with us. Thumbs up to Ann Dodge for getting us connected with the three of you, and I hope that we see you more and more in the years to come in our alumni events and our alumni community. So thank you.